Hello, my friends. Welcome to Momentum Boost. I'm your host, Adrienne Gold Davis, and I'm grateful you're here today, and you're going to be extremely grateful that you tuned in. And before I begin, I just want to thank Marjorie and Jonathan Slass and Mary Ellen and Drew Weissman because today's boost was made possible through their generosity. So thank you so much. Now, to ask our guest a question, and you're going to want to, you just click that question mark on the lower left-hand side of the chat box. So, question marks. This year has been filled with them. And on today's boost, we're going to ask a lot of them, like, what can we do to reduce our own anxiety and soothe the fears of the ones that we love the most? We're going to find out different ways in which anxiety manifests in adults and in children, in men and in women, and what we can do to cope with and reduce that anxiety, and when to finally admit that it might be time to seek professional help. Joining us today is Dr. Gail Saltz. Dr. Saltz is a clinical associate professor of psychiatry at the New York Presbyterian Hospital, Weill-Cornell Medical College, and a psychoanalyst with the New York Psychoanalytic Institute. She's a best-selling author of numerous books, including her most recent, The Power of Different, the link between disorder and genius. She's also the host of the podcast Personology from iHeartRadio. Please join me in welcoming Dr. Saltz.
Thank you so much for having me, and thank you all for attending today.
Dr. Saltz, we feel so fortunate to be able to have you with us. You know, there is such, it's anxiety is so ubiquitous. It was even before what we're facing as a world right now. And of course, things are much worse. Can you speak to the changes and the exasperation of anxiety in the current state of the world?
Anxiety is very reactive to stressors, external stressors. It's not the sole cause generally of anxiety, but it is a big contributor. And right now, we have so many external stressors going on, health-wise, financially, politically. It's kind of hard to pick an arena that we are not having an external stressor in. And I think what's particularly driving anxiety in this case is that there's tremendous uncertainty, right? Anxiety drives us to ask questions. What if? When we don't have an answer to the what if, because there is a lot of uncertainty, it tends to stoke anxiety, particularly for people who are biologically somewhat predisposed to it.
Okay, what does it mean to be biologically predisposed? What's the difference between biological predisposition and just plain, I got a lot to be anxious about, there's a lot of stuff going on? How do you know what the difference is?
So you bring up an important point. Anxiety is not all a bad thing. Anxiety is our body's and mind's way of saying, hey, there may be a danger there and you need to do some problem solving or some running away from the danger. You know, we talk evolutionarily speaking, right? It was the person who was able to say, you know, I think I saw a bear. I better get back in the cave, as opposed to, I don't feel any anxiety at all. I'm just going to go out and then I got munched. So there is some evolutionary positivity, let's say, to a certain amount of anxiety. But at a certain point, what happens biologically is that our sympathetic nervous system gets revved up. That is the part of the nervous system that is the flight, fight response.
Okay.
And in that danger signal, when there isn't necessarily an immediate, oh, I solved that problem, and it stays sustained, we get a cascade, I'll call it, of physical symptoms and then accompanying thoughts in the brain.
Okay, can you give me, yes, I'm sorry to interrupt, can you give me some examples of those cascades?
So I said it in that order of actually physical symptoms and then thoughts in the brain, because it usually feels to people like they have thoughts first and then they get the physical symptoms. But oftentimes it is the other way around, especially when we are already anxious. So initially you may get an input of thoughts that then physically arouse you. But often once you've already got a process of anxiety going on, and you had asked earlier about what do I mean by biologically, anxiety runs in families. Anxiety disorders run in families. There is often a genetic component. And it's important to understand that genes, just because you're born with something doesn't mean it stays that way, right? So nature, nurture, the environment turns our genes off and on, and our brain is plastic. And so, meaning it can also change. And so environmental things can make anxiety worse, but environmental things can also make anxiety better. And by symptoms, I mean, so mentally, what is it? Anxiety, high anxiety, is an irrational fear, a high level irrational fear. That is kind of the hallmark of the thoughts of anxiety. They don't feel irrational in the moment to you, but to an outside observer, or if you're able to be your own outside observer, they are. And they're often accompanied by these physical symptoms of hyperarousal, like breathing very quickly, feeling like a little palpitations, maybe chest pain, nausea, sweating, a sense of jitteriness. Some people just feel this kind of like jittery feeling throughout the day. And some people are unaware of those physical symptoms and really just have a constant loop of, and this is for generalized anxiety disorder, like I said, the what ifs. What if, and then the thought moves in a more and more catastrophic direction is usually what you're having. So that combination is essentially what's anxiety. And what does it cause? It causes another hallmark of an anxiety disorder, which is that you avoid. So the tendency to protect ourselves, right? We don't want to feel anxious. And so it seems natural to want to avoid the thing that makes us anxious. But the problem with that is, and it is a hallmark of anxiety disorders, avoidance. The problem is that when you initially avoid, you feel a little better, right? You were scared, you avoided the thing, you feel less scared. And that better feeling provides positive reinforcement, like, Pavlov's dog, positive reinforcement to the avoidance. And so the real problem for many people with anxiety is you avoid and avoid until you've constricted your world to a very small space.
That would be like social anxiety, right? People who become agoraphobic?
In the case of social anxiety, it is social because that's social anxiety, but it could be a phobia to a certain situation. Like you mentioned agoraphobia, being out in open spaces, but it could be anything. So it could be, this politics is making me anxious. I'm just going to avoid all of it, which, at a moment in time might not be a terrible thing, but generally overall wouldn't necessarily be a good thing. When it comes to your health, some people, I'll be honest with you, in this country, we have, I would call it a public health crisis of denial about COVID, right? Because people are so overwhelmed by the terrifyingness of this COVID pandemic that they are using the defense mechanism of denial to avoid having to, think about it and do all the things that we're saying you have to do, which are many things, but really to avoid the fear of the idea that I will get it and I could die, or my loved one could get it and could die. And so many people have denied its existence. So,
is that what anti-maskers are? Is that the root of that?
Well, I would say it's a big driver. I do think, obviously it's become very politicized in addition.
Right.
But I think part of it is that it is terrifying, understandably, and that denial is a way our mind deals with things that we find very scary. We might not be conscious of that, but we use denial to not feel so anxious. Unfortunately, as I said, that avoidance isn't necessarily a good thing. So when we think about anxiety disorders, we're talking about that triad: irrational, high-level fear, physical symptoms, avoidance.
Okay, so we're talking about COVID for a minute. Let's say a person loses their job during COVID and their anxiety is off the charts because they legitimately think it's possible that within this climate, they're never going to get another job. They're a middle-aged person. Maybe they'll never find another place to work, which means, of course, they're going to be out on the street without being able to pay their rent and so on. How do you calm that down when it sounds irrational, except within these times, perhaps it isn't?
Right. That has made this time very difficult because the stakes, some people, are so high that it gets difficult to tell what's rational and irrational. So here's what I'm saying to people, basically. If you're anxious right now, you're in good company. I'm not telling you it's a disorder. Like I said earlier, a reaction of anxiety is not pathology in and of itself when there is a danger. The dilemma for patients or prospective patients or for people in general is two things. If you're overwhelmingly anxious, your ability to function and problem solve is impaired. And really the purpose of being anxious, let's say about something like this, I might lose my job and how financially will I survive, is to be able to do whatever problem solving you can do, right? To improve the situation as much as you are able to do. And beyond that, continued high level anxiety is simply impairing your ability to function, period. And that's the delineating line that you need to find to decide when you want to move from coping tools that you can do, and I advise you to do even when there's a real danger. If you are very anxious, coping tools can still help you to feel better, not to deny reality, but to feel better, and therefore to be sort of, let's say, in prime form for thinking through problem solving, which you do want to do.
Okay, give
and
me some
that,
of
you want to seek treatment.
All right, so before we go into treatment, because I do want to talk about that, and we actually have a question here, somebody saying, how can you tell if your child should seek an evaluation from a professional? How can you tell when it's beyond something you could manage at home? Somebody else wrote in about how anxiety manifests differently in men than in women. But before we get to that, can you just reiterate for me these tools, these tips that are user-friendly even when there is real and present danger? Can you give us some of those?
Yes. So as I mentioned earlier, your sympathetic nervous system is on overdrive. So the kinds of tools that are helpful for you to be able to do at home is anything that would calm down the sympathetic nervous system and rev up the parasympathetic nervous system, which is the opposite, basically. And the system that's on for eating and having sex and doing other things that you do when you feel more relaxed.
Right.
So those range from things like paced deep breathing. So that is putting your hand on your upper abdomen, or basically diaphragm area, breathing in through your nose to a count of 5, a slow count of 5, with that part that your hand is over rising, not your upper chest. That would be shallow breathing and not helpful. So deep lower breathing, that's rising to a count of 5. And then you're going to breathe out through pursed lips through your mouth to a count of 7. So it's a longer exhale than it is an inhale. And the reason that you do that, or that's helpful, is because it's on the exhale that heart rate declines. Wow. And so basically we're trying to lower your heart rate, lower your blood pressure, lower the physiologic response, which will also help your mind. When you relax your body, it helps relax your mind. So one method is paced deep breathing that you can do for 5 minutes in the morning, 5 minutes at midday, 5 minutes at the end of the day. Or you could try or add to it progressive muscle relaxation. That is contracting a muscle group of the body to a count of 5. You contract and hold it for 5 and then relax it. You start with your feet, toes, do your legs, do your arms, do your shoulders. You can do your back and your abdomen. You can do your shoulders. You can scrunch your face. So you're going to go from your toes all the way up your body till you've relaxed your whole body.
Now, do you have to have, is the letting go part of it? You know how it's 7 seconds with the breath. Do you relax longer than you clench with the body?
No, it's not. There's not a pace to this. There's just a holding it tight.
Okay.
And then release. 30 minutes of aerobic exercise 3 to 4 times a week. There's a lot of data on this. Goes head to head with antidepressants for mild to moderate depression, reduces anxiety, reduces stress. Very, very good. Most data supported. The practice of mindfulness, or actually any kind of meditation, is known to be helpful in reducing anxiety. That takes more effort to learn and engage in. So some of these others are a little quicker, a little more down and dirty. Listening to relaxing music, taking a warm bath or shower, that together, that kind of relaxes you. Talking to others that you find supportive, okay? That's not the catastrophizer in your life. I would definitely, try to have conversations with people that are also able to not go to the worst place, but being able to talk about your feelings. And if you don't feel that you have that person, journaling about those feelings, writing them down, and then reading them the next day to give you sort of more of an objective sense of, oh, that might be a little irrational. That might have been too far, too much. I can see that in retrospect. These are all sort of, there are more, but like there are many sort of tips and tools that you can use and incorporate into your day-to-day existence that can be helpful for adults and children. Okay. So to go to your other questions,
please.
Women suffer anxiety disorders twice as often as men and have double the lifetime prevalence of anxiety disorders as men do. They also tend to, when they have an anxiety disorder, suffer a greater burden, an emotional burden on their functionality of life, more so than men do.
Why?
Except for social anxiety disorder, where men and women are equal in terms of how often they're affected. I can't tell, women are often more aware emotionally affected. It's more acceptable for them to be aware. There are probably a host of social and cultural reasons, but there also seems to be a biology to it, how affected one is by this over-arousal of the sympathetic nervous system and how much anxiety touches off fear. But women are more affected, and therefore it's really important that women be understanding that there is a threshold at which it really is important to seek treatment. Children do not have the same verbal capacity or mental capacity to reflect on what they're feeling and be able to tell you or tell themselves even what they're feeling. And so in children who have anxiety, you're more likely to see symptoms of regression. So in other words, they had achieved certain milestones and now they're stepping back. And so what might that look like? It could be anything from socially, they're stepping back. They socially withdraw from friends and things that they were doing that, had been a milestone that they'd achieved. They want to avoid school or avoid social interactions. They are stepping back from academic achievement that they had attained because they can't concentrate or think in the same way, and that regresses. Or they regress in their daily, day-to-day, what you see them doing. Maybe that's in toilet training. Maybe that's in, how they operated around the dinner table. Maybe that their sleep may be interrupted. Temper tantrums. A child who cannot understand or articulate what they are having go on in their bodies and their minds may just quickly move to sort of anger or overwhelmed and have a temper tantrum. So most parents see a temper tantrum and they don't think, oh, my child is anxious. But if you're seeing repeated tantrums, that may be in the mix, and give that some thought. They will express fears of, you being away from them, or something that they need to go out in the world and do. They may be able to talk about that and therefore avoiding and quickly moving to a tantrum if you say no. So that, in other words, a child may look more rigid, inflexible, but really the adult version, is just with words, right? Adults also will become more rigid, less flexible, more avoidant, melt down more easily and have trouble. Right. The adult has those physical symptoms, plus it's impaired concentration, decreased libido. You don't feel like thinking about sex when you're thinking about catastrophe. And what I would call obsessing or rumination over dark things or distressing things. And like I said, this cascade of what if this next bad thing happens?
When is the time, and it keeps coming up, to take a child to see a clinician? And I would like you to talk about the difference between going to your GP and actually seeking out a psychiatrist someone who is able to know when it's time for medication and treatment combined or separate? And if you could speak to that.
Well, first to children. As many as 25% of all children will have an anxiety disorder sometime in their childhood. It is really important to treat that child because the longer that they stay off their developmental path, right, the more impaired they really are longer term. Nip it in the bud, getting them treatment puts them back on path. And I'm not necessarily talking about a treatment that lasts even a very long time or necessarily medication at all. But a psychotherapy that helps them, it's usually for children, cognitive behavioral type of psychotherapy. It's a limited number of sessions, can mean everything in terms of putting them back on their developmental path, maximizing themselves in their childhood. And the sooner that you treat an anxiety disorder, the less likely they are to relapse, frankly, later due to something called the kinetic effect, which basically is wiring in the brain that is more used gets more used. So when you don't treat whatever psychiatric situation, children or adults, they're more likely to relapse later. So it's important. And I'll tell you, to be honest, right now, the median time between onset of symptoms and treatment in children is 2 to 5 years, which is not good.
Why do you think that is? Do you think parents are afraid?
I think it's not that a parent doesn't love their child and want the best for their child, because they do, but many parents believe deeply, right, that this is stigmatizing and they don't want their child to have something that might be terrible in their lives. So they don't see it. We talked about denial early. They don't see it. They attribute it to something else. So it is hard as a parent. I think the sooner that we all come to grips with the fact that anxiety disorders are so prevalent, and in that way, it's hard to really say abnormal, that treatment helps, the more parents will be able to see what's going on and be able to get their child in. Now, what is the dividing line between, everybody gets anxious, including children. That's okay. You can help them through that. Functionality is the main word I want to say. Can your child function socially, within the family, relationship-wise, in school, academically? Is your child functioning? If their functioning is impaired in any of these arenas, then it's time to bring them into somebody. And the same is true for adults. Everybody gets anxious. That's normal. When your anxiety reaches the level that you cannot function at work, socially, within your relationships, and it can impact all of these arenas, then it's time to talk to a professional. What kind of professional do you want to talk to? I would tell you, you want to talk to a psychiatrist or a psychologist or even a social worker. And the reason many children, the first line, I didn't mention that, this is really important. Another thing that happens with anxiety for kids is somatizing, meaning they don't ever present with these other things I'm telling you about. They just keeps having headaches, stomach aches and pains. And really, because children can't articulate, they often feel it in their body, and that's how they present. So they go to the pediatrician with constant headaches or stomach aches, where adults might also somatize and go to the emergency room thinking they're having a heart attack, right? And that we see this all the time. So often people end up seeing their family practitioner, or they see the pediatrician, and the person, they cry, they tell them they're very anxious, and they hand them the medication. The reason, look, if you really have and there are some parts of the country where there really are a dearth of mental health professionals. Well, I will tell you, in this day and age, telemedicine has changed the game.
How?
You do not need to see that person in person. Myself and all my colleagues were all doing telemedicine, and we didn't before. So, you can see someone elsewhere and get good care. So I would advocate for that. But the reason being that what medication one chooses, and whether it even should be medication or it should really be psychotherapy, at least to start, is something that a mental health professional can help you assess. And it really does matter because, on average, many people don't even respond necessarily to the first medication that they're put on.
Right.
It can be some trial and error and deciding which side effect profile is okay and which medication is safe based on everything from, do you have any history of seizures? Do you have any family history of bipolar disorder? There are so many important questions in selecting a medication that I feel nervous when I hear just, I gave this patient X because that's what I give every patient. And then I won't see the patient again for 6 months or a year because I'm a family medicine person and they just come in for a checkup, is not a great idea for somebody who is incredibly anxious with an anxiety disorder. They should be seen sooner. There are risks to not seeing somebody who you put on medication. Medication as a side effect might make them feel more agitated or more anxious initially, and they may need help with that. They may be driven so to agitation, anxiety, it makes them think about suicide. So that is the reason that if I prescribe medication for someone, I'm seeing them again in a week. I'm telling them that these things may happen in the interim, and I want them to call me if they do. And then once they're on a medication and getting better, we could spread out those sessions. We don't need to meet that often.
Okay. Unfortunately, we're getting close to the end, and there's so many questions here that I'm not going to get to, but I because I have your ear, I get to ask this. What about self-medication, and how frequently do you think that addiction is the result of self-medication? And how can we guard for that, especially in our teenagers?
This is a major issue in this country. We know that, deaths of despair, that those are deaths from addiction and overdose, as well as suicide, have continued to rise. We're anticipating, sadly, a big wave this winter and spring because of all of the issues that are going on and people not necessarily getting into care. It is true that if you are extremely anxious and you have a drink of alcohol, you may feel less anxious, because it is true that alcohol is like the class of benzodiazepine medication in terms of its effect. But it is also true that that same glass of wine a week later will not give you that same effect, because alcohol is a drug that you develop a tolerance to. And in that tolerance, you don't get the same effect. You need more of the drug. And so then you need to have 2 glasses of wine, and then you need to have 3 glasses of wine. And eventually you've got a problem. You've got an abuse problem. And when you try to stop and try to peel back, you go through withdrawal, which feels awful. And if it's, serious withdrawal can be dangerous. So these are the people are unfortunately using over-the-counter prescribed opiates to feel more relaxed. This is a problem. That's not what it's meant for. And again, you develop tolerance, then you develop an addiction. So I would really just advise people to be aware that it doesn't matter if a doctor prescribed it for you for pain or not. And it doesn't matter if it's legal, like alcohol, or not, or legal or maybe not illegal, like marijuana or not. Using a substance that that one can develop an addiction to treat something that really needs a different kind of treatment is likely to only increase your problem. You're then likely to have substance abuse and an anxiety disorder, because of course, anytime you stop whatever it is, you will just feel that anxiety again, which is why I want to make a pitch for the value of psychotherapy, which is the brain, as I said, is plastic, and you can change your brain's wiring with psychotherapy. Now, you can also change your brain's neurochemistry with medication, but understand that medication is only making that change as long as you're taking the medication. Psychotherapy is making that change. So you learn something in psychotherapy that makes change that's lasting, and you've built coping tools, and they will last you. And so medication when needed, and sometimes it is needed, because you can't learn and participate in psychotherapy if you're severely anxious. So sometimes you have to do it additively. But I would really advocate for people considering often cognitive behavioral therapy, which is time limited, like 10 sessions, maybe 20 sessions, or psychodynamic psychotherapy, a different style of looking at unconscious conflict, but to look to that initially, and then consider medication if need be.
Doctor, I don't even know how to thank you. You managed to cover in this last half hour the majority of the questions that so many of us have asked about. I mean, this has just been a gift to everybody. And on behalf of me and everyone at Momentum, I want to thank you for giving us your time. Truly, you should go from strength to strength.
Thank you. Thank you so much. Thank you for listening. And just know there are many people, professionals to reach out to, as I said, even by telemedicine. And I would advise people who are feeling really, really anxious to do so for themselves or for their child.
Beautiful. Oh, it's just wonderful, wonderful, wonderful. Okay. Wow. So once again, thank you for sharing your expertise. This conversation has been like entirely illuminating. And there's been, like I said, too many questions for me to answer. So we're hoping the doctor can join us again in the future. But once again, how can we thank you, Marjorie and Jonathan Slass and Mary Ellen and Drew Weissman? This was a gift to all of us. And be sure to join us on Friday, November the 13th, because we're going to have a live cooking demonstration with Chef Deanie Klein. She's going to reveal, get ready for this, the hidden versatility of a humble store-bought rotisserie chicken. Oh my gosh, all my secrets are going to be out there now. And she's going to show us how to whip up creative, delicious meals with what you've got sitting in your house. Okay, so join the fun with me as we laugh and cook our way into Shabbat. So to register for our upcoming boost, just click the link that's above me right now or visit momentumunlimited.org. And don't forget, please respond to the poll that's going to come up on your screens after our short video. But for me, Adrienne Gold Davis, and all of us at Momentum, remember as we learn and grow together that one of the highest forms of wisdom is kindness.